So with that, it's my pleasure to introduce today's presenter, Dr. Jackie Gray. She's a Choctaw Cherokee Research Professor and Associate Director at the Center for Rural Health at the University of North Dakota. She's the Director of the National Indigenous Elder Justice Initiative, or NIJI, which is funded by the National Center on Elder Abuse and Title VI programs of the ACL to address issues of elder abuse in Indian country. NIJI was first funded in 2011 and has worked to develop resources for American Indian tribes, Alaskan villages, and Hawaiian homesteads since that time. Dr. Gray's worked addressing health, mental health, and health disparities across Indian country and internationally, working with Maori suicide prevention. She's a mental health first aid instructor, and she's worked with tribes across the U.S. for 35 years. She received her doctorate from Oklahoma State University in '98 and has been at the University of North Dakota since 1999. So at this point, Dr. Gray, I will turn things over to you and make you the presenter so that we can see your screen whenever you're ready. There you go. Looks great. Right. And whenever you're ready to start.
All right. Thank you, Andrew. And welcome, everyone. It's a pleasure to be with you and share a little bit about some of the work around elder abuse in Indian country. Okay. The National Indigenous Elder Justice Initiative, or NIJI, as Andrew said, has been funded since 2011, and as far as what the objectives, I'll tell you a little bit more about that. We'll talk about the different types of elder abuse and understand how there are different definitions of elder abuse from perspectives of legal, tribal authorities, and Indigenous elders, how to screen for elder abuse within Indian country, and share some examples of restorative justice and what some of the resources are that we have. When we first developed NIJI, we wanted to come up with a vision that didn't focus on the abuse, but what we wanted the outcome to be. And so the vision of NIJI is to restore respect and dignity by honoring our Indigenous elders. So what is elder abuse? And I believe probably most of you know that according to the National Center on Elder Abuse, it's any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. The legal types of elder abuse include physical, sexual, emotional, psychological abuse, neglect, financial exploitation, self-neglect, and we've added, because of what our elders have told us, spiritual abuse, which was first defined by Doble. So first of all, the types of abuse, physical abuse is usually the first one that's talked about. That is defined as the use of physical force resulting in bodily injury, physical pain, or impairment. And it includes pushing, striking, hitting, beating, shoving, shaking, slapping, kicking, pinching, burning, types of things that are physical in nature, and can include the inappropriate use of drugs, physical restraints, force feeding, physical punishment, things like this. Now, these are the National Center on Elder Abuse definitions. When we ask tribal judges what they considered to be physical abuse, they talked about an intoxicated son who hit an elderly parent, or an elder that's hit by an adult child, assault and battery on grandpa because he wouldn't give the grandson the keys to the truck, an elderly man with dementia hitting his wife. Those types of examples were what we were given. And the Title VI directors, which are those that are in charge of the senior nutrition programs, talk about the daughter hitting the elder because she was frustrated about his needs and health, or a granddaughter slapping an elder, or those family members that are taking drugs or using alcohol, and that leads to yelling and hitting of other family members. So it's a little broader definition than what the judges saw. When it comes to sexual abuse, again, from National Center on Elder Abuse, we get the definition as non-consensual sexual contact of any kind with an elderly person. So this may be because they're not capable of giving consent, or it can be things from unwanted touching to sexual assault to rape, coerced nudity, sexually explicit photographing. Now, our tribal health directors, we didn't hear anything from tribal judges. They basically didn't see anything as far as sexual abuse. And the tribal health director, though, was telling me about grandma being raped by a male who was high on meth and broke into her house. And she was so ashamed that that was the first time when she was talking with the tribal health director that she would even speak of it, and didn't want to report or tell anyone. But after several hours of talking with the tribal health director, she finally agreed to go to the hospital for an exam. Now, the Title VI directors also hear some of those stories as far as grandma being raped by a nephew, and again, wouldn't talk and was ashamed, or an elder being raped and killed. However, there were no, as far as the tribal elders themselves, they did not come up with any examples for sexual abuse. And a lot of that goes to the shame. Emotional and psychological abuse, again, the National Center on Elder Abuse definition is the infliction of anguish, pain, or distress through verbal or nonverbal acts. This can be intimidation, humiliation, harassment, treating an older person like an infant, isolating them, giving them the silent treatment, and social isolation where they aren't allowed to interact with other people. Now, the judges saw emotional abuse as the relatives being mad or drunk and coming into the elder's home yelling and scaring them. Or grown children move in with the elder and the drinking, fighting, taking their money, chasing away caregivers that tends to threaten the elder. Family violence, and an elder may be afraid to testify against a family member. Confining the elder to one room and they have no interaction with family or anyone else. Or the mother contacting the police to remove the intoxicated children who have moved in and taken over the home. Those are all viewed by the judges as being emotional abuse. Title VI directors would hear stories about the children abusing alcohol in the elder's home. Verbal abuse by young family members, yelling mean things, the children treating the parents and the grandparents, or threatening the parents and grandparents with putting them in a nursery home if they couldn't come and live in her house with her. But the tribal elders themselves really talk about the verbal abuse and not listening when elders speak, treating them as if they don't matter anymore. This sense of disrespect that I'll talk about more as we go later on. Neglect is also defined by the National Center on Elder Abuse as the refusal or failure to fulfill any part of that person's obligations or duties to an elder. It may deal with fiduciary responsibilities to provide care for the elder, to pay for their services, or failure to actually provide the necessary care or in-home service. This can be, refusing or failure to provide with food, water, clothing, shelter, personal hygiene, medicine, comfort, personal safety, other essentials for the elder. Now, our tribal judges, when asked about neglect, talked about the elder being confined to the home and the family not providing support. How an elder would complain of loneliness and there would be no opportunity for that socialization. The family not checking on an elder if they're unable to take care of themselves. Or the family going away and leaving the elder without any food, or not getting proper medical treatment for the elder. The elders, however, talk about being locked in their homes, lack of family care and attention, being neglected that way. They're too busy to take care of the elders, not visiting or taking elders to gatherings. Lack of family care and attention. So very much putting the elders away and not having interaction with them. Other things include abandonment, such as desertion of an elderly person by somebody who's supposed to have responsibility for providing care, or someone that has physical custody of the elder. And along this line, I was out on a reservation doing some research at one point, and we were set up at a powwow grounds. And we had arrived there early to get all of our equipment set up and everything. And someone came out and set up a tent and left this elderly woman in the tent in the middle of July in the hot sun. And we went over to check on her after a couple of hours because no one came back, and that she had been left there with no water, no food, and it was late into the evening before any of her family came back to check on her. So we went over and made sure that she had water and something to eat and things like that while she was left out there in the tent by herself. That kind of thing can be considered abandonment. When we talk about financial or material exploitation, we're talking about illegal or improper use of an elder's funds, property, or assets. Usually this includes, but it's not limited to, cashing the elderly person's checks without authorization, forging their signature, misusing or stealing a person's money or possessions, coercing or deceiving someone into signing over a document, improper use of conservatorship, guardianship, power of attorney. In Indian country, well, when this happens, we don't, the restitution usually comes too late, if there is any at all. There's no time for the elder to rebuild any assets because they're usually at the end or into their time that they're no longer working or maybe retired. They have a loss of choices, a loss of independence when that happens. They tend to be more reliant on others, although they've helped to support others throughout their whole life, and more quickly end up down to Medicaid. So when talking with elders, we talk about planning ahead and under what conditions would they want someone to manage their finances, and under what conditions would they want to be placed in a long-term care setting. Staying connected with one another, the elders staying connected with one another and checking in on one another. Having kind of a buddy system where people who regularly attend events and aren't there, somebody notices. One example of this, one of the reservations that we work with a lot, they had an elderly woman who hadn't been to their noon meal for a couple of days, and some of her friends noticed and went to the elder protection team and asked if anybody knew, anything about her. And no one knew anything, so they sent someone out to check on her. This was in the winter, and they found that the woman had fallen. She wasn't able to get up. She had ended up frozen to the floor. And if she hadn't been found when she was, she probably wouldn't have survived. Her fire had gone out in her house, and so it had gotten extremely cold. The elder protection team was then able to work with her and develop a plan to find a better housing situation for her and more interaction and provide the assistance that she needed without taking over everything. So this is a way to help prevent the outcome that in another situation where someone hadn't noticed that she wasn't around, she probably wouldn't have survived. Another thing is being cautious, and our elders tend to be very generous with whatever they have. If they have enough to take care of their bills, they're willing to share anything else over and above that with others. But cautioning them not to provide resources without checking out the situation so that they don't end up having someone tricking them out of their money. And reporting their suspicions. If you think abuse may be going on, letting someone know, asking the authorities to check on it or intervene. These are all things that we talk with our elders about in ways to help protect themselves. When talking about exploitation, our tribal judges talk about situations where a granddaughter wiped out grandma's bank account, or misusing the elder's monthly check and not paying for their food and medical bills and other costs. Title VI directors talk about the family gambling away the elder's income, or taking their personal items or their check. You see, these are a little different types of situations than what we see for most of the general population. Pardon me. When we asked tribal elders what exploitation was, they talk about a grandchild taking an elder's car and wrecking it, or the grandchildren coming over and pressuring the elder for money. I frequently have heard of young people that they know when the grandparents are getting a check from the tribe, and they want to make sure that they're the first ones over there so they get money from the elder before it's all gone, really taking advantage of their generosity. In some situations, family would cash the elder's check and then lock the elder in their room so that they could go out and spend the money. Borrowing money and never paying it back. Or a granddaughter and her boyfriend moving in and being supported by the elder. Many times what we see with our elders are taking in grandchildren, or a child dropping off their children for the grandparents to watch them and not coming back for months, and that grandparent ends up supporting those children on their limited income, which is a form of exploitation. Being taken advantage of by relatives, again, using them as a place to park the grandchildren for food, clothing, and babysitting. Now, spiritual abuse isn't covered among the legal definitions. However, Doble described spiritual abuse as anything that interferes with the spiritual growth, including the corruption of another person's value system. We see this as, in our discussions with Native American elders, as being more than psychological or emotional abuse or neglect or exploitation, because it hits at the core of who the person is and damages them deeply at that level. Some of the examples we've been told about are not taking an elder to spiritual activities or ceremonies, taking their ceremonial items and either selling them or using them without permission. Some of those ceremonial items are to only be used for certain things, but if someone that doesn't have permission takes it, it's an extreme violation of that person's spirituality. Activities that damage their spirit. Improper touching by a spiritual leader in a ceremony goes beyond sexual abuse, because it also violates that spiritual piece for the elder. And you understand a little more of that from a historical perspective in soul wounding, is a term used by Duran and Duran in their book in 1996 on Native American post-colonial psychology. So again, some of those examples are that elder not being taken to ceremonies and spiritual events, not being allowed to conduct, a lot of times over 70% of Native Americans now live in urban areas. Many of those Native people have not been around their culture in their homes for most of their life, but they may want to return home at end of life and have ceremonies, especially in the hospital as they're dying, or other end-of-life types of things, and don't have the connections to a spiritual leader to provide those ceremonies. Again, the ceremonial items taken from the elder's home by visitors, family, friends, or others to use or to sell. These and many others are examples of spiritual abuse. And we've got an article out under review right now that hopefully will be accepted to help define and conceptualize what spiritual abuse is. So why are our elders vulnerable? Well, Native culture supports generosity. And as I said earlier, if anyone has anything beyond what they need, they're willing to share it with others. That being done within the culture, the expectation is when you need something, others will share it with you. So our elders are sharing, expecting to be taken care of when they need it, and that second part isn't being fulfilled. They also have a trusting nature, trusting in others to do what's right. They may easily be perceived as foolish or being able to con them. And elders in our communities tend to have more of a steady source of income than many families because of the high unemployment. And also they may be isolated more so, which makes them more vulnerable. So when we've taken a look at some of the research in Indian country around elder abuse, you have to understand that this is a very diverse population. There are 567 federally recognized tribes and Alaskan villages in the United States. Each of these has their own distinct culture. And then, in addition to that, there are over 400 either state recognized or unrecognized tribes. So there aren't any large-scale population-based studies of elder abuse in Indian country. Each of those are independent and sovereign, and so you'd have to get permission from each one of them in order to conduct a population-based study across the U.S. There's a national study, but it's not focused on elder abuse, but just on the needs of Native elders. And I'll talk a little bit about that in a few minutes. There are other studies that are small, focused, regional or local areas, and may focus just on one type of abuse. For example, in 2009, the National Elder Mistreatment Study was a national study that included almost 6,000 older adults. 2.3%, or 132 of those adults, were American Indian or Alaska Native. 11.4% of the nearly 6,000 reported experiencing at least one type of maltreatment in the past year. But the problem that we have with these studies for American Indians and Alaska Natives is where the asterisks in the study. There's no specific data because they say it's too small to analyze. So we don't get any of that information about our population. Brown in 1989 studied a southwestern tribe that was and he looked at a sample of very traditional older adults. There were 110 American Indians that were surveyed, and then a random sample of 27 they did individual interviews with. Of that sample, 16% indicated that they had been physically abused, and almost a third indicated neglect. And 21.6% indicated there had been financial exploitation. So we see this much higher than what we see in the big national studies when we look at this sample of one reservation. In 2000, Buckwald and Associates excuse me, did a study with a northwestern urban sample of American Indians and Alaska Natives who were 50 and older. They reviewed medical charts for physical abuse of 550 American Indian Alaska Native patients. 10% definitely or probably were abused in the last year, according to what was in their medical record. The abused ones were more likely to be the younger females who were depressed and dependent upon others for food. And of those that were abused, only a third were reported. And this is physical abuse only. In 2009, Baker Demery had a study of 470 American Indians and Alaska Natives aged 55 and over. 54% lived on a reservation or in a native village, and 23% were urban. The others may live close to a reservation, in a rural area, or in a suburban area. The greatest concerns in their community around abuse and neglect were neglect, emotional abuse, and financial exploitation. And men were more concerned than women in this study. But one of the most important things that came out of Baker Demery's study is that American Indians and Alaskan Natives describe abuse as disrespect and sexual abuse as bothering. What she found was that when Native elders were asked if they had been abused, they said no. But if they were asked if they had been disrespected, they would get the stories about the abuse. And with sexual abuse, again, if they were asked directly about sexual abuse, they would deny that there had been any. But if they were asked questions about bothering or being bothered, they would tell the stories of what had happened to them. Jervis and her team in 2014 had a survey that they used, that they looked at 100 people from a south central urban area and a mountain west reservation. And these participants were over 60 years of age, and found that financial exploitation was the major issue, and there was very little discussion of physical abuse. The survey did not look at sexual abuse at all and did not address spiritual abuse. Hudson and Carlson in 1999 looked at what is an elder versus the elderly. And an elder status in Indian country is achieved through wisdom, substance and value, and being held in respect. Elderly status is ascribed just based upon their age. Another factor was the way they described good treatment is someone anticipating the elder's needs and then meeting them without asking what their needs were. And elder maltreatment then was verbal abuse, yelling and screaming. And they found that American Indians indicated this was abusive more than other ethnic groups. They also looked at African American and Latino populations, and they did not rate the verbal abuse as high. Many felt that the abuse would end if the younger generation would adhere to more traditional cultural norms. So getting away from their cultural values, they felt like had increased the amount of abuse that was occurring in Indian country. In another study just published earlier this year, Jervis and Associates, with this same sample of 100 urban and rural older adults, found that being treated well was defined by being taken care of, having your needs met and anticipated, and being respected. Being respected involved providing assistance to the elder, acknowledging the elder's status, spending time with the elder, and family including the elder in their activities. So involving the elder as a important part of the family was a key piece to being respected. Conversely, being treated poorly involved examples including financial exploitation, neglect, that lack of respect, talking back, screaming, yelling, things like that, psychological abuse, physical abuse. In that study, 16% reported being treated badly, and 76% gave reports of others being treated badly. And what you find in Indian country is you're more apt to hear stories about other people than you are complaints by elders about being treated badly themselves. They also took a look at financial exploitation, which involved money, exploiting the elder in terms of getting money from them, using their labor, whether cleaning houses or taking care of children, doing other things without paying them for it, and taking advantage of their housing. And again, the exploitive child care is a common thread in Indian country. As far as neglect, the types of things that the elders highlighted were not having needed assistance to the elders. So the family not taking care of that elder and meeting their needs. Being ignored or being overlooked as elders. Elders is a place of is a position of esteem, and they aren't feeling like they're treated that way. Another big thing is failing to visit the elders or putting them in nursing homes so they don't have to take care of them. The other thing is the family only helps when it's convenient for them, not when it's needed by the elder. Lack of respect was described as failing to respect the elder's wisdom, speaking rudely to or near an elder, excuse me, and being inconsiderate. Psychological abuse, verbally harassing the elder, name-calling, verbal assaults, lying to the elder, high-stress households with alcohol and drugs or conflict tend to be psychological abuse as far as they were concerned. And then physical abuse they saw as being beaten up, hit, or forced to drink alcohol or take drugs. Now, the National Resource Center on Native American Aging has conducted the Identifying Our Needs, a survey of elders over the last 20 years. They do this in 3-year cycles. And for the cycle that was completed in 2014, there were over 18,000 American Indian and Alaska Native elders that were 55 and older, represented from 240 tribes, Alaskan villages, and Hawaiian homesteads. Of those over 18,000 participants, 0.5% currently used elder abuse prevention services, and 13.4% would use those services if they were available to them. When NEJI first started, we checked with every tribe and village in the United States and found that of over 567 tribes, only about 40 had elder abuse codes in their laws, and even less had procedures for, or policies and procedures for investigating and enforcing those laws. Some other things that came out in the National Resource Center study is that 32% of elders fell between 1 and 4 times in the past year, and 5.5% fell more than 4 times. That 1 in 6 elders had less than 2 meals a day, and 1 in 9 elders had no help at all with chores. About 1 in 8 had no money for food. And again, about 1 in 9 was unable to cook or feed themselves. 1/4 of all of those elders ate alone most of the time. And 1 in 5 lacked any companionship. And between 22 and 49% had no help with chores or bills. So we see a lot of needs by those elders. So what are some of the elder abuse indicators that we were able to pull out of that data, although they didn't ask direct elder abuse questions? Again, the unexplained falls, checking into how or why those elders are falling. Malnourishment or inadequate food. When you have 1 in 6 that are eating 1 meal or less each day, you've got a high chance of malnourishment or inadequate food. Unable, no help to shop, cook, or feed themselves. About 1 in 10 reported that they weren't physically able to do that. And about 1 in 8 reported that they don't have the money to buy the food that they need. Some of the other elder abuse indicators, they don't have any help from family or friends to shop or run errands, 1 in 5. With handling their money, almost over 40%. They don't get any help with housekeeping or chores, almost 1 in 3. And they don't get any help with business or financial advice. Almost half of our elder population gets no help. But the companionship issue was one of the major ones that they really talked about a lot. And that's about 1 in 5 didn't have any companionship. So that isolation and loneliness was very important. When they were asked about what resources they had within their tribe and that they used, you see the left-hand column is the percent that actually use the services that were available to them. And the right-hand column is the number that would use it if it were available to them. So a lot of those things end up being areas of potential elder abuse. Many times, especially with federal grants, we hear that they require that you use evidence-based practices. Well, most of those practices have never had evidence developed on them within Indian country. But the other thing that we tend to have a lot in Indian country is what we call practice-based evidence, things that we have learned through practice that provides evidence that they work to help prevent, in this case, elder abuse. So some of those programs that were developed in Indian country from a restorative justice approach are more successful than the Western legal-based programs. Our elders don't want the people prosecuted for elder abuse. They don't want their family members removed or sent to jail or anything like that. They want something that will make the situation better. So some of the examples of the programs that are used in Indian country include the multidisciplinary elder protection teams. The difference between the ones in Indian country and the ones that we see in the general population are the native elder protection teams include the elder and are built around the elder, to where they're involved in helping to make any of those decisions about what's going to happen to them, and involved with the other resources that may be pulled together to discuss what their needs are and how to go about meeting them. Another example are the elder councils. Okay. The elder councils are made up of selected, respected elders in the community, and people who are disrespected, or elders that are disrespected or abused or neglected, as we might say, are brought before the elder council. The elder council addresses the issue. They listen to what the situation is and what happened and what's wanted. And then they may instruct the abuser in proper behavior from a cultural perspective. They may order restitution in some way. Or in extreme situations, they may call for banishment, to where that person is not allowed to re-enter the community. These are all cultural old ways that was how we handled situations for hundreds of years. There's one program at the Standing Rock Reservation where a traditional chief does a offenders group, and he does it from a cultural perspective, and he goes through what the expectations of those attending the group are for their position in the community and in the family. And he has almost a zero recidivism rate of anyone that's been through his group. As far as restitution, one story about two neighbors, and their boys had grown up together their whole lives. And one of them killed the other in an argument. And so the Council of Elders ordered that other son to also be the son of the woman whose son was killed. In other words, he had the responsibility for caring for her as he would for his own mother, to replace the son that he had taken. That's how we tend to look at restitution, finding a way to meet those needs as if they were still able to meet them before whatever was taken away was taken away. And banishment, again, is an expulsion from the community. The family restoration programs are similar to a mediation type of program, but it's before any prosecution attempts are made that and they come in and address the abuse. It may have been an investigation, and they come in and discuss with all the parties to identify whatever the family and elder needs are, and to connect them with resources, but to try to change the situation to where it will be more positive and reduce the chance of repeated abuse. The plan is developed with a mediator or social worker, and it's implemented with the family, and then there are follow-up sessions to make sure that the plan is working and each person is doing their part. And sometimes there needs to be some modification or revision as they go along in order to deal with situations they hadn't thought of. If it doesn't work or there's non-compliance, then they can move on forward to prosecution. But this is a means to prevent having to go through prosecution and restore the family to a healthier function. Operation Golden Shield is a community policing type of approach. At-risk elders are identified, and then by Bureau of Indian Affairs Social Services, and then the BIA police, when they are not out on calls, may drop in and have coffee with an elder, or visit, or change a light bulb, or check the smoke alarm, or just kind of touch base and see how things are going and make sure that kind of like a wellness check, but it's building that relationship with the elder. They also had special events like taking over a prepared Thanksgiving meal and bringing a special Christmas gift, or having an elder sweetheart for Valentine's Day. This also, it lets those in the family and the community know that the police are checking in with the elders and know what's going on. Two, it increases the likelihood that the elders are going to ask for help when and if they need it. So this is all done voluntarily out of the pockets of the BIA with this program, and they've been very successful in reducing the elder abuse in that community. Now, NIJI has a number of resources available. That includes an interactive map of state and tribal reporting numbers. You go to the map, click on it. There's a drop down that provides a list by county and tribe as far as any resource numbers and things like that for elder abuse. We also have tribal elder abuse model civil and model criminal codes that tribes can use to help develop an effective code for their tribe. We have training modules up on our site for social services, caregivers, financial and commercial providers, and we provide technical assistance. We are in the process of developing some additional modules for legal, policy, and healthcare providers. And we have an elder abuse survey that we are in the process of contacting tribes that have told us they're interested in surveying their elders about elder abuse, that we're going to begin here in the next month. Right now, we also have a call for proposals out for tribal mini grants to develop elder abuse resources in their communities. These are $10,000 to $20,000 grants for 1 year that to help develop new and innovative ways of addressing elder abuse in Indian country and helping to take them on to the next step from where they are. There's a lot of needed research, and we're trying to address the fact that we really need a comprehensive assessment of elder abuse throughout Indian country. And this is planned with the survey that we have. We need to determine what services are available in tribal communities. Although the Tribal Law and Order Act was passed to where there could be more interaction between state and tribes as far as prosecutions, cross-deputizations, dealing with a lot of the jurisdictional issues that exist, very few tribes have the money to pay for the legally trained tribal judges and public defenders that are necessary to be able to implement that. And so they're still stuck with having very limited prosecution in Indian country. If a non-Indian offender abuses a native elder and they don't have the Tribal Law and Order Act, they cannot be prosecuted if it occurs in Indian territory. So there's lots of things with jurisdictional issues that really create problems. And when we look at the violence numbers, assaults of women in Indian country, 2/3 of those assaults are from non-Indian offenders. So you can see that cross-jurisdictional piece really has a major problem in Indian country. We also need to do some research with some of those tribally developed programs to determine if there's evidence of their efficacy, that they can become an evidence-based program, that then the tribes could be able to get funding for using those programs. When we're talking about screening for elder abuse, our best practice is everyone should be screened, and that we should normalize talking about those difficult topics. We need to use the language that the elders use and talk about disrespect, not abuse, and talk about bothering, so that we're talking about those things and what can and can't be done and where there should be intervention. We need to ask questions that create the potential to catch the abuse in its early stages and prevent it from escalating. Some of the screening may involve questions like, are you being disrespected? And if so, in what ways? Has anybody hurt you? Are you afraid of anyone? Is anyone taking or using your money without your permission? Is anyone taking your things without your permission? These are some of the references of what I've covered today. And that is my contact information if you need to get in touch with me. Our NIJI website, where a lot of those resources are that I mentioned to you. And you can go to the info@niji.org if you want more information about the grants or the survey that we're going to be doing. And at this point, Andrew, I'll turn it back to you for the questions.
Certainly. Thank you, Dr. Gray. That was very, very interesting. And we do have a few questions, a handful of questions. This first question came in, I think, early on in your presentation, and it was asking about which tribes and locations were studied with the question. I think it may have been from the examples that you were giving with the different types of abuse and the different kind of cases that you had seen. And I don't know if it's one particular tribe or location you were mentioning then, or a variety of them, but I thought I would at least toss that question out.
Yeah, some of the different studies. There was one with the Navajo. There was another one that involved Blackfeet and an urban Indian clinic in Oklahoma. There was another one that was done in Seattle and another one that was done in North Carolina. So they're from various regions of the country. The National Resource Center study, like I said, covered 260 tribes, Alaskan village, and Hawaiian homesteads across the country.
Okay, so good variety, it sounds like.
Uh-huh.
You were also mentioning the different types of abuse early on in your presentation, and someone had asked about self-neglect. I think it might not have been included in the group, and they asked if you could describe whether the experience of isolated elders in unsafe conditions is different in Indian culture.
Well, I did not address self-neglect, and I'm sorry about that. We don't tend to separate that out. But
kind of included.
Yeah. As far as how we see it, the isolation, I think in a lot of terms, because of the high unemployment, a lot of our tribes have 80–90% unemployment.
Mm-hmm.
That isolation and lack of resources, and the big thing for especially those in tribal areas is lack of transportation. Mm-hmm. And, your long distances from the store or getting to the doctor or anything like that, that it really does compound the neglect issues.
Sure. Yeah, it makes it more difficult to deal with because of the isolation. Great. Another question was about the Family Restoration Program and asked if there's any templates or guidelines/instructions for that program.
That program that I specifically know about was out of the Tohono O'odham tribe in Arizona, west of Tucson, I believe. And they developed that out of their Adult Protective Services program, and an interest one of their workers had in that. But if someone's interested in more specifics, I'd be happy to try to get some more information about it.
Great. We'll get their contact information or give them your contact information. Appreciate that. Which is also up on the screen right now.
Yeah, it helps.
Pull it off there. Yeah, that does help, doesn't it? Let's see. Another question is, in the example of the murder and the response using restorative justice, is this the complete handling of the situation, or are local police also involved or required to be involved?
Again, you get into jurisdictional issues.
Mm-hmm.
If it's on tribal land that something like this occurs, and it was between two natives, the FBI could be involved. But if one was native and one wasn't, or some of those things, jurisdictional issues are where the law may not be involved at all.
Gotcha.
It's that the jurisdictional issues are really complex. Mm-hmm. Depending on who's the offender and who's the victim and where did it occur and all of this. And sometimes things just get dropped because they don't want to mess with it.
Gotcha. Sure. Here's another question. Go ahead, Jackie.
I didn't address there are Public Law 280 states in which the tribes and the states work together and the state does the investigation on those, but that's only about 6 states in the United States. The rest of them, the state and the tribe, as far as legal stuff, is totally separate, unless there's some type of memorandum of understanding.
Great. Yeah, no, thanks for that clarification. Another question that came through, what do you do if an elder that has a hard time remembering or has a hard time realizing that they're being abused? How do you handle those situations?
Those are difficult situations.
They are.
Really,
I think
someone else involved to help with that. Yeah, go ahead.
Are there guardianships in tribes? Do they have like a guardianship system where somebody can step in and if a judge says so to take control of the situation? Does that ever happen?
It really varies from tribe to tribe as to whether they have anything or not. Some tribes do. Other tribes, they may have someone that the tribal court says, okay, you're going to do this. And others, they don't have anybody that will take that on.
Gotcha.
So it really varies. One of the things we're trying to get developed, and I've been working with ACL on, Omar had mentioned to me having a guardianship or a power of attorney that has a checks and balances, where one person has the authority and another person has the right to review and monitor what's going on. So it isn't all left to one person. And it also provides some protection to that person that takes on that guardianship, because someone else is also checking the books and checking other things to make sure that they're being followed through as they're supposed to be.
Yeah, right.
So we're trying to come up with a model, one of those that we can get up on our website.
Yeah. Yeah, and that's an issue with guardianships in general, so yeah, I can certainly understand that. Another question that came through was, this person remarked that they found it interesting that about the difference between the words abuse and disrespect. How has that played out in securing legal assistance that requires the use of the term abuse? And do you feel like the wording needs to be changed in the law to apply to American Indians?
Well, I don't know if the word needs to be changed in the law, but in eliciting their stories, using the terms disrespect and bothering tends to get to those stories. And I think through the stories, through them telling what happened, they can get what they need as far as it meeting the criteria of abuse. Is that making sense?
Yeah.
Okay.
Yeah, no, I think it does. Yeah. Another question is, what happens if an older adult refuses help?
They have that right, as long as they're competent.
Just like with the rest of the population, it sounds like. Another question is about a Native Elderly Advisory Council or panel. Do you see those that come into play in certain communities?
I haven't seen that with respect to elder abuse. I think probably the Elder Council is probably more along those lines that we saw within the Pueblo tribes. But not as the question would then be an advisory to who?
Yeah, that's a good question. I don't know if it's just a general kind of advisory council of elders or just for a specific group.
Now we have had groups of elders that have gone to their council and really pushed the issue of getting an updated elder abuse code into their tribal codes. So, you know, they can be very activist in some of their things. And providing, those elders also provided guidance in the development of those codes as to what they wanted to see in them.
So proactive, going and saying what they think it needs to be.
Very much.
Yeah. Let's see. What would you say are some of the main obstacles of access to help among the Indigenous communities?
Well, I think, as I mentioned, the jurisdictional issues are big problems. The lack of elder abuse codes and policies within tribal communities.
Mm-hmm.
I think those are two of the biggest ones. And I think the isolation.
Yeah.
Really gets to be a problem. And we also get into some of these things like here in western North Dakota and eastern Montana a few years ago, there was the oil boom. And we had reports of elders whose rent had been raised 10 times to where they couldn't afford their homes so that they could get them out and rent to people coming into the oil fields at a much higher rate. And I see that as exploitation.
Yeah, but because the market changed, yeah.
Right.
Let's see. Do you have any information or know of any information on elder abuse among the LGBTQ individuals within Indigenous communities? Or anything you can say about that issue?
Now, what I provided in this presentation is all of the elder abuse research in Indian country. That's it.
Wow.
And so there's a real need for some of that research to be done. We are trying to gather some more information, and we're hoping to do a training module as far as work with Two-Spirit. And that's the term within Indian country, is Two-Spirit people. And hoping to include some of that, but it kind of depends on how things move forward, whether we'll be able to do that or not.
And then one other question, and I think this is probably our last question, is are there very many community services available for elderly American Indians in the U.S.? Do you find that it's hard to get services for those folks, or are they available at all?
It really varies tribe to tribe. There are some that have nothing, and there are others that have really developed some comprehensive services. And you see it all the way between.
Yeah, kind of all over the place.
And there's, there really isn't any funding out there. These mini grants that we have out now are the first funding that has gone into tribes, other than, I think there were 3 tribal grants about 5 years ago. And before that, there was money back in 1985. And that's about all that's gone into Indian country. The other thing are the programs in the states, the AAAs.
Yeah, the Aging Network.
Yeah, the Aging Network. All the funding that goes to states for those different types of things are also supposed to be serving Indian country. Many times they count the natives and then don't serve them.
Yeah.
We see that happening all the time.
And here's another question that just popped up. Sometimes APS is told, quote, it is the Indian way, unquote, for elders to support their family. Can you speak to this?
And that is true. Everybody does their part or has a role. It may be that the elder's income is needed to support the family, but in those cases, other members of the family are doing other things that contribute to the well-being of the family. It's not, you have to take a look, is there exploitation going on with it, or is it a mutual benefit of all the members?
Gotcha.
That's the part that is the Indian way.
There was an earlier question about the advisory panel piece, and this person clarified that they were asking about if there was an advisory panel of elders for NEG itself at the university that you work at.
Yes, we have a national panel, our National Advisory Board.
Great. Well, I think that's all the questions that we have, Dr. Gray. Oh, here's another one that just popped up. Is it best to say Indian or Native American or American Indian? Which term do you think is most appropriate?
Well, that's an interesting question. My personal opinion is most like to be referred to by their tribe, like I'm Choctaw and Cherokee. Mm-hmm. But whenever we're differentiating between groups, if it's among the tribes in the lower 48, it would be American Indian. If we include Alaska, that's American Indian / Alaska Native is the preferred term by the National Congress of American Indians. But when you throw in Hawaiian homesteads, I tend to use the term Native American.
Great.
Other people see it differently, but that's kind of the way I differentiate it.
Gotcha. Well, thank you. That's very helpful. I think that's probably a question on a lot of people's minds because they hear different terms, different times.
But most tribes prefer to be referred to by their tribal name.
Sure. Yeah, of course. That makes a lot of sense. Well, thanks so much, Dr. Gray. I think that's all the questions that we have. We appreciate all the information you provided to us and all of the research that you presented to us. And it sounds like there definitely needs to be more research into this area. And the field is lucky to have you working on those issues. We really appreciate your time today in presenting for us. Several people have commented thank you, and it was very helpful information.
Thank you very much. I've enjoyed it.
Yeah, we've enjoyed having you. And just as a note to everybody who's on the line, make sure to please complete your evaluation. Once the webinar ends, the evaluation will pop up on the screen, and if you could complete that for us, it'd be great. It's just about 5 questions, I believe. It'd be very helpful for us. Thanks so much for being present, for signing up today, and thanks to Dr. Gray again for all the information she presented. And at this point, we'll say, everyone have a great afternoon. Thanks so much.
All right, thank you.